are you able to hear this sound? This sound is due to the vibration of this metal disc. It creates vibratory sounds, waves that hit your tympanic membrane, the eardrum. It causes the eardrum to vibrate in the same way that this disc is vibrating as well. Well, interestingly, your brain is surrounded by 3 membranes. Your brain and your spinal cord are surrounded by 3 membranes called the meninges. And these meninges also are actually thinner and vibrate as well, as do other parts of your body when you have a sound impacting you. Now, explosives, concussive devices, IEDs, rounds of ammunition, all of them are very much stronger, higher decibel sounds that can influence and could cause vibration and traumatic vibration of the meninges. This is why it's very important to have your meninges tested to see if there may be some torquing or twisting or some compression of the meninges or inflammation that is causing your brain and spinal cord to not work properly and to disrupt messages. That is what the neurologic release center technique and process that I'm trained in, certified in, and practice as one of the adjuncts at the Redwood Clinic is all about. Give us a call if you feel that perhaps this may be part of the issue why your system is oversensitive, why you may be having some post-traumatic stress disorder, and why the cumulative traumatic encephalopathy is not being addressed properly because the meninges are not being looked at.